Good morning. It's great to have all of you. We're here this morning because we all want good health care and because we want what is best for America. But good health care and government-run health care are not the same thing. As a father and small businessman, I know health care costs are skyrocketing at a time we can least afford it. I support health care reform, but reform that holds the line on costs and doesn't replace a messy insurance system with an even worse government-run health care system. I oppose this government-run health care bill before the Congress because it is too expensive, it's too bureaucratic, and it takes too many risks with our economy and our health. We need health care reform that lowers costs for working families. Look, I run a small business. 88% of all new jobs in the United States since 1993 have been created by small businesses. But small business will be squeezed in this power play. Connolly and Pelosi's proposal will guarantee that small businesses will be forced to jettison their private plans and put their employees on the government-run health care plan. Let me explain. Right now, my company, I pay about 70% of my employees' health care costs. They pay the remaining 30%. Combined, it's about 10% of our total company payroll. The government-run health care plan will offer to cover our employees for 8%. So Obama's pledge that if you like the plan you're on, you can keep it is a big deception. With their incentive system, it's a no-brainer. If I keep the plan I have, I'll be at a serious disadvantage to my competitors. I'm no fan of insurance companies, but just because they are part of the problem doesn't mean this fatally flawed bill is the solution. As I said in my healthcare town hall at the Fairfax County Government Center on September 1st, healthcare comprises roughly 17% of our nation's economy. So why should the federal government roll out government-run healthcare nationally? Why not start with one state? I run a company that's nationwide. When we introduce a new product or service, do you think we roll it out nationwide? Of course not. Of course not. If government-run healthcare is so good, let's try it in one state. Let's try it in Illinois. Let's try it for a year. Then let's compare the results with expectations. If the differences are small, let's tweak it. Who thinks the differences will be small? If the differences between how we think a government-run healthcare system will run and how it really runs are like the government's response to Katrina, then let's scrap it and start over. Let's be rational here. The Congressional Budget Office estimates the House bill will cost $1.055 trillion over 10 years. 25% more, by the way, than Pelosi and Jerry Connolly estimate. The unfunded liabilities of Medicare right now are north of $37 trillion, so this is all the more reckless. The House bill imposes $572 billion in new taxes, mostly with a surcharge of 5.4% on joint filers earning over $1 million, which means the burden will fall mostly on small businesses that are subchapter S's and limited liability corporations, small businesses like mine and yours. And that, my friends, will have a severe negative impact on hiring, on job creation, and on economic growth. If you increase my taxes and healthcare costs, I have to let people go. Congress has limited resources but unlimited spending desires. Because the money for government-run healthcare is not available today, we must reach into our future and rob our children of their future to pay for this madness. And as we drown in a sea of red ink with trillions of dollars in new obligations, we will ultimately have no choice but to decide which treatments which patients get. Can anyone deny that inevitability? Not only that, any bill that fails to address wellness and tort reform, as this 1990-page behemoth fails to do, is not reform at all. I mean, let's face it, it's an agenda-driven outcome propelled by partisan politics of the worst kind. Folks, Connolly is going to vote on this bill, and we will know where he stands when he does. Here's where I stand. I would vote no on this bill and on government-run health care in its current form because it's bad for our nation. I call on you, Jerry Connolly, to reject it also. If we're to reform healthcare, let's don't just ram something through. Let's think it through. And then let's get it right before we ready, fire, aim. For the sake of our nation and our children, let's get it right. Jerry Connolly, I call on you to reject this train wreck piece of legislation. Thank you, God bless you, and God bless America.